Chairman of the Select Committee, Steve Brine.
Thank you very much, Mr Deputy Speaker. It's a pleasure to follow the opening speech from the Honourable Lady from Bradford South, who's brought back many happy memories of our time together when I was indeed the Public Health Minister, and she's been very consistent on this issue over many years. Today's debate, very timely, Mr Deputy Speaker, comes at the week when the Health and Social Care Select Committee, which you rightly say I'm privileged to chair, held a crucial oral evidence session with the Minister, who is in his place on the front bench. Dentistry is a subject very close to my heart, from my time serving as Public Health Minister in the department, and also one of our top priorities as a Select Committee. We launched our inquiry into the subject shortly after I became chair in November just last year. We're looking at what steps the government and NHS England should be taking to improve access to NHS dental services and at further reform to that NHS dental contract. Rarely, I would say, has an inquiry been more needed or welcome. It's clear that there are huge problems facing NHS dentistry, and I'm sure every colleague in the chamber today and not will be familiar with stories of constituents having trouble accessing NHS dentistry, and I'm no exception to that, both as a constituency MP and indeed my family and I as a patient. One of the submissions, many submissions we received, talked about people extracting their own teeth with pliers, something that should not be possible in the 21st century. The problem is obviously particularly acute in some areas of the country. We'll hear talk today about dental deserts, I'm sure, and among some groups of people. But challenges and capacity issues are being experienced across the board. Our inquiry received a wide range of written evidence, including from nearly 30 local health watch groups. We also held 2 detailed oral evidence sessions examining both the problem and, of course, the potential solutions. We've heard from Health Watch that the majority of complaints they receive at the moment are about dentistry. Day in, day out, local Health Watch groups are receiving emails and calls about problems accessing an NHS dentist. And this is also reflected in the evidence we received. I know it's not easy for some to hear this, but I can only follow the evidence that I receive as a Select Committee Chair. We've also heard again and again about the challenge of recruiting and retaining NHS dentists. Now, the government have, I'm pleased to say, started to act and pick up on some of the previous tinkering reforms, for which I take some of the credit and also some of the responsibility that I didn't fundamentally reform the dental contract either during my time as dental minister. Now, in July last year, the government announced several changes to that 2006 dental contract, including a change to the way units of dental activity, or UDAs, are awarded and advising longer recall periods for adults with good oral health, in line with those NICE guidelines. In our first evidence session, Mr Deputy Speaker, we heard from Sean Charwood from the British Dental Association, who told us that these reforms to the dental contract represent tweaks rather than the fundamental reform that is needed. He said, and I quote, "In essence, what we are doing at the moment is rearranging the deck chairs on the Titanic while the service slowly slips into the sea." To be fair to the Minister, who I have a lot of respect for and spoke really well at our Select Committee earlier this week, I was delighted to hear him acknowledge to that session that he does want, his words, quite fundamental reform to the dental contract. That has to be right. He argued that the existing reforms were welcome, but noted that they were only a start. I think that's very good to hear, and it was well covered on the media on Tuesday evening. I do worry, though, that even if significant reforms to the NHS dental contract were made tomorrow, it will be too late or an extreme challenge to bring back those dentists who've already left the NHS dental workforce. It's really hard for people to make that decision. They came into dentistry to work in public service, and I feel once they've made it, it's final for them, and it's going to be very difficult to get them to change their mind. Perhaps the Minister, a subject that I touched on with him earlier in the week, could tell us a bit more about what he's going to do to address that return issue. In our session, I asked him about his ambition for NHS dentistry. Tony Blair famously, 1999 conference speech, said that his ambition was for everybody to have access to an NHS dentist within 2 years. It never happened, but it was a clear ambition. I give him credit for that. Now, the Minister said the number one thing on his mind was improving access for those who don't currently have access to a dentist. Quite right. But when I pressed him on whether that meant everyone will have access to an NHS dentist, he said that he wanted everyone who needs an NHS dentist to be able to access one. I think this is welcome. It's a repeat of that ambition, and I think it's good that the government have that ambition. Obviously, delivering it and when is the key, and I would ask him to expand on that today when he sums up. He also talked about making NHS dentistry, Mr Deputy Speaker, more attractive to dentists, which is clearly crucial. So I know that the Minister said that the problem is not a shortage of dentists per se, it's a shortage of dentists who are undertaking NHS dentistry, and the figures certainly do bear that out. Our work has highlighted the point that there is a problem with data as well. There are headcounts for the number of NHS dentists, but we don't know whether they're part-time or whether they're full-time and how much NHS activity they do. That is a gap that needs closing. We need to know about the workforce that's available to deliver the Minister's ambition, because until we do that, the ambitions are likely to be achieved. And the Minister reminded us this week, Mr Deputy Speaker, that the government is in the final throes of drawing up its workforce plan, which I understand will include dentistry. That is good. I hope that plan will be published in the not too distant future, maybe once we get past a certain electoral event next Thursday. There's also an issue that I just want to touch on, Mr Deputy Speaker, about overseas recruitment into this profession. According to the General Dental Council, almost a quarter of dentists registered in the UK gain their dentistry qualifications overseas. And that's fine. But for these dentists, the primary means of assessment is something called the Overseas Registration Examination, or the ORE. Now, the pandemic created a backlog of overseas dentists waiting to take their exams. That's the good part. The ORE is subject to practical and legal constraints that make it difficult to adapt capacity to meet changing demands for places. Now, recent legislative changes should help to ease the problems, but are unlikely to make a significant difference in the short time. Discussed, the Minister can correct me if I'm wrong. One of my constituents, Christopher Hilling of SPA Dental Group, who's spoken to me about the subject on several occasions, has outlined the difficulty he's facing. He has a number of dentists who are waiting for the opportunity to sit the ORE exam, but he's struggled in the past to get accurate information about when the exams will even take place. He's concerned that he might lose more of his overseas dentists due to a lack of exam opportunities and communication by the General Dental Council as to when they might be able to practice as dentists in the UK. Now, given the delay in changes to overseas registration taking effect, can the Minister tell me what the government are doing to support the GDC in this, especially with regard to clearing the backlog of applications? I was also very encouraged, Mr Deputy Speaker, to hear this week the Minister and the Chief Dental Officer, Sarah Hurley, talk in our evidence session about the importance of driving forward work on prevention. It's a passion of mine. Colleagues will know it's a major inquiry the Select Committee is undertaking. And one of our witnesses at this week's session talked about the importance of early prevention work, focusing on young children. The expression she used was getting gums on seats, which I think is a great place to focus. We must get more gums on seats, Mr Deputy Speaker. That is a catchphrase for today's debate. Finally, I just want to talk about integrated care systems, which we've also done a lot of work on as a Select Committee. We heard in our session about some of the changes that have come into effect as a result of ICBs taking responsibility for commissioning dental services. Some were early adopters, including the Hampshire and Isle of Wight ICB that looks after my constituency. But they don't have dentistry on their boards. The reason given for this, when I asked a Hampshire ICB who appeared this week as one of our witnesses, is that they don't want to make their boards too big. I find this disappointing, I find this surprising, I find this unhelpful. Some ICBs have, to be fair, managed to include dentistry on their boards without any problems. So if they can do it, then all should. I think it sends a very strange message to the dental profession that they're not included on integrated care boards. It's a great opportunity for flexibility and commissioning, which is why we created them. Dentistry needs to be within them. To conclude, Mr Deputy Speaker, the picture is bleak, but it doesn't have to be. It is also improving. There are grounds for optimism. We've got a Minister who understands this subject inside out, who is committed to providing access to NHS dentists for everyone who needs it, and a thorough overhaul of the current system, the contract, as he confirmed to us this week. And in integrated care boards, we have the possibility of being able to target local services to local needs. But the time for action, Mr Deputy Speaker, is running out. I hope the Minister can outline in his response to us today that he recognises the urgency of the situation, and that when my committee produces its report on dentistry, he will read it and act promptly on our recommendations. Thank you very much, sir.